A lot of people struggle with SI joint pain during sports or just daily movement, bending over, walking, or just going about their daily tasks. In this video, I'm gonna break down the biomechanics behind the SI joint pain, why it occurs, why some treatments only work short term, and few simple activities you can start doing straight away to start improving it. So let's start with some anatomy and biomechanics. The SI joint is the joint between the ilium bone and the sacrum bone. The capability of this joint is really small. The studies show only 2 to 4 degrees of movement, but the pressures inside the joint can become very large depending on how these two bones interact with each other. When our body center of gravity gets shifted forward, this ilium bone right here externally rotates. When this ilium bone externally rotates, especially this back of the ilium bone gets pushed into the sacrum, which compresses the SI joint and can lead to inflammation, irritation, or just pain signaling. But most importantly, with this excessive external rotation, we lose the ability of these two bones moving relative to each other, but now they are one piece with a lot of pressure on the sacral base. So the loss of normal motion between the ilium and the sacrum occurs. Think about the pelvis like this water balloon. If I squeeze the back of the water balloon here, I'm going to create a compressive strategy at the back and everything is going to shoot forward. So we get this compression at the back and expansion at the front. Same thing we're seeing at the pelvis when the back compresses and the front expands. So that compressed area at the back reduces the space needed for normal joint movement, nerve movement, but also all of the other soft tissue motion. And this is why many different symptoms can come out of the same movement strategy. Because the forward center of gravity shift is so important, I created a free 14-day email sequence where I email you one exercise each day in order to shift your center of gravity back. If you want that, check the link in the description. So now we have this back of the pelvis compressed due to that forward center of gravity shift. Let's talk about some muscles that are holding the pelvis in this position. There are many of them like piriformis and other external rotators, but I'm gonna be focusing on glute max for the sake of this video. Because the glute max attaches on the ilium, sacrum, but also thoracolumbar fascia, as well as the femur, when it concentrically orients, it's gonna create a nice pressure at the back of the pelvis, compressing this ilium into this sacrum, holding this externally rotated position. Because what glute max is essentially made to do is to compress the back of our pelvis in that toe-off phase of walking so we can push this side of the pelvis forward as we land other side in front of us. So if you're someone that's dealing with SI joint pain, bilateral hip thrusts and excessive glute activation is just gonna drive this further external rotation in the pelvis, compressing the back of the pelvis. So those activities are usually not something I would recommend. So many traditional SI joint treatments focus on glute activation, SI belt, or core activation. Most of these approaches compress the back of the pelvis more in order to stabilize the joint from moving. And yes, this can resolve the pain in short term, but that doesn't reduce the real issue, which is the compression of this ilium bone into the sacrum. We shouldn't be increasing the compression, we should be reducing it. I think pelvic belts are really useful if they're made with this biomechanics in mind. This is actually why I created the Levo belt. Most pelvic belts compress the back of the pelvis. The Levo belt works in the opposite direction, trying to close the front of the pelvis so it reduces the pressure on the SI joint. If you want to check that out, links in the description. So since the ilium is stuck in this external position, we have to be working on restoring the internal rotation capabilities of this pelvis. Because the internal rotation will open the back of the pelvis, reduce the pressure created from this ilium onto the sacrum, and restore this joint motion. One of the simplest ways to do that is to apply lateral compression at the front of the pelvis close to this ASIS here, which will internally rotate this ilium. But before we do that, we have to calm down the muscles that are holding our pelvis in this position. So for this first activity, I'm just gonna use a foam roller and I'm gonna place it directly behind my hip bone right here. This is usually where glute max attaches, just below the greater trochanter on the proximal shaft of this femur. Now I'm gonna be rolling from this hip towards my SI joint on this glute max, stopping few inches before I hit the SI joint, but I'm gonna be working slowly, going from the hip towards the SI joint, then reducing the pressure and returning back quickly, playing with different angles to hit different parts of that muscle, but constantly working from the hip towards that SI joint and the sacrum. I'll do that for 5 to 6 minutes. For this next one, I'm gonna use a lacrosse ball and I'm gonna sit directly onto lacrosse ball with my sit bone, which is basically the pointy bone you usually sit on. From here, I'm gonna roll my sit bone to the outside of the lacrosse ball so the lacrosse ball falls to the inside of my sit bone on these deep glute muscles here. And I'm just gonna hold it here. Inhale through my nose, exhale through my mouth, trying to let go, letting the ball dig into that glute, melting onto the ball. And now we're taking care of that glute max that's closing that space on the backside of the femur. Breathe in this position for 2 sets of 10 to 15 breaths. Now that we've reduced some of the muscle tension, we can start working on mobilizing the pelvis into positions that we want. Then we'll reinforce that position with loaded activities. So for this activity, I'm going to use a half roller and I'm going to place it directly on the side of this ilium bone, helping me to create this position and close the front of the pelvis down. So I'm going to set up, get into this position, get the pressure where we want it. Hips and knees are bent. My heels are underneath my butt here. Hand is underneath my head. First, I'm just gonna lay here, relaxing into the foam roller, melting into the foam roller, just breathing, trying to relax as much as possible. I'll do this for 4 to 5 minutes. Silent inhales, long exhales. Then I can add this. I'm gonna inhale as I'll lift the top leg up, rolling to the back of the pelvis more, keeping this knee down on the ground. And as I exhale, I'm gonna be stepping over, turning into this side more, landing this knee down on the ground in front of me. Again, relaxing in this position. Inhale back up, exhale, step over. Then I'm gonna do 3 sets of 10 reps. Backing those up with this lazy rolls is a great way to get the pelvis to move. So I'm gonna start in the side lying position, get something underneath my head, hand on hand, knee on knee. From here, I'm just gonna breathe silently. Don't focus on breathing too much, but just focus on reaching your left, in this case my top arm and knee forward, rolling the top side forward, getting into the bottom side. Take an inhale here. As I exhale, I'm going to be going back. Again, don't focus on the breath, just focus on relaxed, effortless movement. And now I'm rolling back. I'm not pulling my shoulder blade back, but I'm rolling through my spine. Top side back. Inhaling here. Really just soft, effortless movement with as least muscle tension as possible, trying to get that hip to move again. Do 3 sets of 10 reps of this. So now we can back that up with a loaded activity like a Campo deadlift. So I'm gonna be starting in this case, if I was working on my right SI joint, I'm gonna be putting my right foot back, left foot forward, right toes in line with my left heel, and the weight is gonna be in my left arm. From here, I wanna keep this right hip, knee, foot in line and this right heel heavy with right knee behind the left throughout. I'm gonna align the weight with my backside leg and foot here. I'm gonna stay heavy on the back heel. I'm gonna inhale in this position, hold the inhale as I lower down by bending my hips and knees but keeping the back straight. getting into this hip, keeping this knee forward, lowering the weight in front of my backside foot, exhaling, pushing up. Inhaling, really trying to stay heavy on the back heel, lowering the weight down, exhaling, pushing back up. So as you can see, the SI joint pain is not solved by creating more tension. It's solved by reducing compression, restoring pelvic motion, and building movement patterns that support that pelvic shape. Hope this helped. If you like this video, make sure you watch out my Push Belly video that dives into similar principles that apply onto the SI joint as well. And if you want to work with me or learn more, check the links in the description.